The COVID-19 pandemic has made profound changes to many aspects of our everyday lives and the services that so many depend on throughout the region. But how is it impacting community health center services? I spoke with Amelia Spiliotes, the CEO of Community Health Programs, to find out more.
CHP is actually a series of community health centers spread throughout the Berkshires. They are largely primary care practices that it could be as if you used to see your own doctor in his office, except you come to one of our practice areas somewhere throughout the county. So it's largely primary care practice servicing the community. We do have some specialty. We have pediatrics and we have dental and we have women's health services, but it's very different than going into a hospital to see your physician.
And so then in this time of COVID-19, I understand that CHP, like hospital settings as well, made some changes to make telehealth possible, also put some services on hold while you were sort of adjusting to all of this. But where do you stand right now in the services that you're offering to the public?
Well, we pivoted pretty quickly when the COVID-19 broke. In a matter of 2 or 3 days, we were fully live on a telehealth platform, largely video, but some telephonic. We had pop-up tents in the parking lots for our practices, as well as we were doing what I like to call curbside medicine, which is we were seeing patients in their cars and doing blood tests for different things. We're not doing COVID-19 testing. So we have largely migrated our practice out to a virtual setting. But the one thing that's still clear to me is that we're not ready to take people back into the practices. So we did see in the very first week a drop in our visits from patients to about 30 or 40%. Now, fortunately, with things in place, we're back up to 65, 70%. But I think it's going to be a little while before we actually bring people into any of the centers for their health care. We don't have any plans for immediate reopening. We plan on continuing this way until it's safe to do so and that everybody feels comfortable, patients, staff, and the community.
And what are you using as your guidepost to help you understand when you feel like, as the CEO of this organization, that it is safe to start doing that again?
Well, obviously we're taking some of our signals from the local agencies and certainly the state, and largely looking at what, the CDC and the public health officials say is really a guidance or guideline that we should go through. I think the challenge that everybody is facing is testing. And we have not had a lot of testing in Berkshire County. There's a lot more that needs to happen. And I think until we can feel comfortable that we're able to test the numbers of people that we need to test to be sure that it's safe to bring people back, we're going to continue to do things as we've been doing.
As this pandemic has unfolded, we've heard a lot about how hard hit hospitals have been because they stopped doing those maybe elective procedures or routine procedures and have really pivoted hard into treating COVID-19 patients. And then more recently, we saw Governor Baker meet with a number of heads of hospital systems to say, you know what, you need to come back into the healthcare system. It's safe if you've had a heart attack or a stroke, things like that, massive events that maybe people were avoiding seeking hospital treatment from out of fear of catching COVID-19. What are some of the major ways that COVID-19 has impacted the services that CHP provides?
We immediately, when it came to our dental service line, stopped doing anything but emergency. We stopped taking sick into the health centers, and we again moved everything remotely to telehealth and telephone and outside where it was safer to be. I think the difficulty is that a lot of individuals had become very afraid to tax the health system to come and do the types of procedures that they thought that they needed to have done for fear. And I think one of the things that we found is that as a community health center, we really are the front line. I mean, we are the reason why people are being seen and taken care of for chronic conditions so that they don't have to go to the emergency room and that they don't have to go to the hospital. So we're really looking to shore up and make sure that our patients feel comfortable approaching us and calling us for a telehealth appointment, or for another kind of service that they feel that they need, so that we can talk with them about it and we can direct them appropriately to where they need to be seen. Do they need to come to the health center to be seen in one of our parking lot tents? And is that a way we can take care of them? Can we take care of them by constantly monitoring them for their hypertension and for their diabetes through the use of telehealth? I mean, looking at all of those resources that we have to bear to get them the kind of health oversight that they need to keep them from having to go to the hospital or the emergency department.
For you, financially, what has this meant for CHP? I know for a bit you were interim CEO, so you had a large hand in helping to restore the financial health of community health programs. But what's the financial picture look like for you now during COVID-19?
Well, we've been, I would say, fortunate. We're one of 42 health centers across the state of Massachusetts. And I look at my sister health centers, and some of them had much difficult challenge and ended up having to furlough people, to lay people off. We were very fortunate in that we were able to move quickly and get the telehealth piece up and running, where we were able to keep people employed. And then we've taken advantages of the various stimulus programs and also some local agencies and state money as well. So we're in, I would say, better shape than probably a lot of people. And if we can just keep on continuing to encourage people to avail themselves of our services through the telehealth platform, then I think we should be fine. And, we'll see what the future holds. We don't know how long this is going to go on for. We don't know what it's going to look like when things finally shake out. So we're just very grateful for the fact that we've been able to keep ourselves going and doing everything that we can to do so.
So what's the concern that you're looking at related to COVID-19 as we move forward here?
How do we first and foremost keep everybody healthy? One of the things that we've done is, in order to conserve and protect our staff, is to rotate staff in the centers on a 2-week basis. So on a biweekly basis, one team's on, another team's off, and back and forth. I think that's really a primary concern for us to have that. We have, through our Family Services Division, done an amazing outreach into the community for food delivery through the mobile food banks and for mini mobile food banks. We've delivered some 2,816 bags of food in this last month through a variety of sites throughout the county. And I think there are going to be more people that are going to be in need of food. There are going to be more people who are in need of housing. I think those are the things to be concerned about, and all the while keeping people safe.
I think just finally, on a slightly more lighthearted note here, stress relief is so important to people during this challenging time. And I read in the Berkshire Eagle that you were friends with someone who's near and dear to the hearts of many PBS viewers, Julia Child, and that you actually cooked her a Greek meal.
I did indeed. She and I go back a long way. We were at Smith College, not together, I'm happy to say, but I met her there and continued a friendship, and made a small purchase of some of her cutlery from her television show, and thought it would be a great idea to invite her to my house for dinner. And she said, "Why, Leah, I'd be delighted."